information that we are sharing today is our own personal experience and does not constitute as medical advice. We do not endorse any products or services. Any said products or services mentioned on this podcast may not be suited for you or your condition. Please consult your physician before making any medical decision. Today's episode is sponsored by the Wolfen Chair in Digital Health. The You Can Do study, a Canada-Netherlands network in precision medicine in childhood arthritis and rheumatic disease, will allow doctors and families to quickly know who needs biologics, which biologics works best for their individual child, and when can the biologic be safely stopped.
Canadian and Dutch physician researchers formed an alliance, You Can Do, together with patient and industry representatives and policymakers to develop the first genomics-based, low-cost biomarker blood test to rapidly identify the best treatment for each individual child, completely transforming the care of childhood arthritis. More about how they want to achieve this will be featured in future episodes.
Hey everyone, welcome back to Take a Pain Check. Today we have the privilege to talk to Dr. Monica Shaw. Dr. Monica Shaw is obviously a doctor, but also a model and a public figure. She attended LECOM, I don't know if I was supposed to say it the other way, Bradenton in Florida, studying osteopathic medicine. In 2019, she completed her residency at Largo Medical Center and then went on to complete her fellowship in rheumatology at Regional Medical Center near Tampa, Florida. She's currently working as a rheumatologist in the Tampa Bay area. Additionally, she is a fashion model and a previous beauty pageant sovereign as Miss India, Florida. She also appears in the second season of the reality TV series Bravo's Family Karma. Okay, now that we got that out of the way, welcome. We're so excited to have you here. How do you enjoy being the other Monica?
I know. What's so funny is we're really good friends. So we go way back, like over 7 years. So we're really good friends. So I'm honored to be the other Monica.
Wow, did not expect that, kind of.
Yeah, we're really good friends. So
especially in the Indian community.
I know, right? It's always like 1 degree or 2 degrees of separation.
Yeah.
Before we jump into just like TV stuff and modeling, we obviously brought you on here because you have a connection to rheumatic diseases in a way that you are a rheumatologist. How did your interest in rheumatology kind of come? Like, what kind of sparked your interest?
So back, like, as far as I can remember growing up, I remember my mom having some trouble with her hands and like performing, daily activities. And I was always just like, it's probably just nothing, or, you probably are just working too hard, like all the other Indian moms in the kitchen and just, overdoing it. But, as I got older, I was like, there's probably something else going on. And then when I did my residency, that's really when I got like my first foot in the door as far as, being around a rheumatologist and understanding like, wait, it's more than what just meets the eye or what the complaint is. And it was in my first year of residency, actually. So I had no exposure during medical school. Like, you hear the terms, but you're like, okay, whatever. Mm-hmm. And I had no rotations in medical school, but it wasn't until residency, my first year, that I got paired up with a rheumatologist and I worked with her for a month. Mm-hmm. And I was just so inspired. I absolutely loved my month on rotation. And it was after seeing how she did her practice, seeing the type of patients she saw, that really sparked my interest. And then I'm like, wait, I can really help my mom, among so many other people. Mm-hmm. So that's really when I knew. It wasn't too long ago. In fact, maybe 5 years ago now, or 4 years ago. But that really is what was the catalyst to all of this.
Yeah. And so I guess the importance of the field kind of began with your mom.
Yeah, it began with her and just being around her and just hearing little things, but not catching on to, understanding what more it could mean. And then when I did my rotations, that's when I realized, wait, this is there's a bigger spectrum here. And there's just a whole population of people that actually need more assistance and need more attention. So that's really what was, the spark.
Yeah, I feel like you always have some sort of personal connection, even though it might not be totally affecting you personally, but maybe a family member or something that you studied. and you've kind of like gotten some connection to it, which is like really great that I mean, it's not great that people have arthritis or rheumatic diseases and have pain everywhere, but it's great that there are people that are willing to help out is
I
what I
think it's
meant.
just great that there's like so many modalities of treatment and just the field is changing so much. So I think it's just exciting to be a rheumatologist personally.
And it's changing as we've seen, it's changing very, very fast. And
Yeah, I mean, and I am hearing it from my mentors, people that have been in the field for much longer than I have, that in the last 10 years alone, there has just been a surplus of resources, whether that's treatment modalities or therapies that are out there now that people can use. And the really amazing thing is now you're actually seeing firsthand that these patients can live a totally normal life. Like you might not even know that they're battling an autoimmune disease. Just because they have full functionality with all the therapies that are available now. So it is one of those fields that is like restoring like a sense of like pride in myself, because I'm like, wait, we're giving you like life back. So that's really exciting for me.
Wow. And obviously, so you mentioned that you just like came back from work. Was that like at the clinic or the hospital?
Yeah.
Okay, cool.
Primarily clinic. So the good thing about rheumatology is that it's a very structured environment in the sense that it's a clinic-based field of medicine, and you have, your schedule of patients for the day, and that includes, follow-ups, new patients, and then procedures as well. So
yeah. So how does your like day-to-day life work at the clinic? Like you mentioned a few like aspects like follow-ups and like treatments and stuff like that, but how does it work on a daily basis?
Okay, so let's start with coffee. Starts with coffee. But yeah, I get into the office by like 7:45. First patient's usually at 8. And that could be anyone from a new patient to a follow-up. And we see a wide spectrum of things. So we'll see the bread and butter osteoarthritis, but then we'll see patients with lupus, patients with rheumatoid arthritis, patients with scleroderma, Sjogren's syndrome, kind of the whole spectrum. And it's great because I know people always think like arthritis, you deal with patients that are older, but our diseases can or conditions can affect patients that are, as young as 15 and as old as, over 100. So we're really seeing the whole spectrum. And then on top of it, we'll do procedures, which, patients come in for joint injections. So we'll be able to go ahead and help them with that. And then we have an infusion suite as well. So there are modalities of therapy that are IV based. And so we have a nice little setup in the back with recliners and TV, and just make it as comfortable, snacks, just make it as comfortable as possible.
Yeah.
Joint injections are Natasha's favorite thing in the world.
Needles.
I was diagnosed at 11 and Natasha was diagnosed at 13.
Really? So juvenile,
idiopathic, whatever you want to call it.
Yep. Yeah.
JRA,
JIA,
really knows.
Wow. So you guys are in it and you're fighting and you're living.
Yes, we are.
And that's kind of why we began this podcast, as kind of
awesome.
We've seen, I mean, like in the last 11 years that I've had the disease, I've seen the medical field change, and I've also seen patients come to the forefront of it. In Toronto, where I went to, I didn't go to sick kids, so for me there wasn't a lot around me. Like the clinic that I went to was small, so I didn't get as many resources. And so from that, as I got older, I kind of thought, well, it's not really fair to kids that are going to smaller clinics, because that's just locality wise where they can go. Yeah. And that's kind of how we started this, and it became a thing.
I love that. You guys are educating the masses. And I think that this is so kind of, I want to say, in the back burner of a lot of people's minds when it comes to conditions that people deal with. I know we're so used to seeing cancer and heart disease and a lot of other things. But this is this is something that's the real deal, and it's affecting people as young as yourselves. So I think that this is really what needs to be happening right now, are these conversations. And especially I feel like in our culture, it's almost taboo to talk about your conditions, like to say that I suffer from X, Y, or Z. It's almost looked at negatively. And so I think that this is where I really want to come in and change the narrative and have these conversations and open up this dialogue, because I think it is so important to know that you're not alone. And you guys found each other, which I think is so amazing. And you're bringing in like you're finding a community of these people. And I think that that's so important. That's something I really strive to do, is bring people together. You're not alone in fighting this, and you can live your best life and have your fullest potential.
Yeah.
So I'm really like thrilled to be able to like have the hands-on to be able to do that.
I just kind of wanted to know, like, what do you think the most difficult part of your job is?
So I think the most difficult part of my job, and I speak for myself, I am a younger physician. I'm fairly new to the field of rheumatology, and a lot of my colleagues are, more established, older physicians.
Mhm.
And so going into the room and, allowing the patient to communicate with you, and then opening that dialogue with them and letting them know, hey, I'm your physician, like I'll be taking care of you today. And I get it time and time again. It's like, oh, are you the nurse? Are you the doctor? So I think battling that is always, it's something I come across every single day, since I can remember. And I don't think it'll stop. And that's okay. But I take that as like one of those challenges that I enjoy, because it's something like, okay, well, yeah, I am your doctor and I will be taking care of you. And you kind of build that trust with them. And you tell them everything you know. And what I love most about those patients is that it allows me to learn as well, because I'm here reiterating and specifying everything as far as how the condition came about, and what the therapies are, and what we're going to start them on, and what labs we need to do, and how often, and et cetera, et cetera. So it really becomes like a very involved discussion, which I think for me is good, because as being new in the field, it's always good to just reiterate. And I get the opportunity to do that. And it's really fulfilling when they're like, oh, wow, like no one's ever explained it to me this much. No one spent this much time with me. And that's the bonus, is that you're new, you can spend the time with them and build that trust. And then that relationship will carry on forever, like for as long as they'll be, my patient essentially, because that's also what I loved about rheumatology, is that these are chronic conditions. And unfortunately, I don't have a cure. But I will develop this lifelong relationship that they're going to come back and keep seeing me. And then it turns into more than just, hey, like so robotic as far as like, hey, how are your joints? It's more like, hey, how's your vacation? Or how are the kids? And it becomes like a whole thing. And that's really what I enjoy about it, is that it becomes like an interpersonal relationship. So you're doing medicine and you're having these dialogues with these patients.
Natasha, I think we need to fly to Miami to just see Dr. Monica.
Get a new rheumatologist.
Come on down.
Yeah, literally.
I don't know if our health insurance would allow for that.
Yeah, I know, right? They have like, what is it? The traveler's insurance. I think that'll work.
She already got us prepared where we're going. And you mentioned like all these like relationships that you've built. I know like maybe for Trish, can you kind of expand on like the adult rheumatology world and how like the conversation about your vacation or anything like that, like
it's really funny, because like now it'll be like, I know them, I remember the last time we spoke, and then, I'll see them again in 3 or 4 months. So it's not even something that I bring up. It's like, hey doc, I was telling you about, we're building this house. Well, I want you to look at these pictures and look at what we did. And this is the granite we picked, or whatever. And so it's dialogue for them. You created a comfortable environment, and patients really open up to you. And I think that is the most important thing as a physician. Bedside manner is everything. And that cannot be taught. So it's either like you either have it or you don't.
Yeah. My doctor definitely does not.
Mine does. I'm pretty sure. Like she definitely has some conversations.
But yeah, no, I mean, I definitely don't deal with a lot more of pediatrics, but irrespective of that, once you create an environment that's comfortable for your patient, you'll be surprised at how easy it is for them to just open up to you. And, a lot of it is transparency. Like sometimes we'll be like, hey, did you take your medicine? And they'll be like, you know what? Honestly, no, I didn't. So, and then, it makes it easier to treat the patient. They'll really be honest with you about, hey, I don't think I'm going to be able to do this, or hey, I don't like injections, or hey, I don't want to take a pill every day, or whatever it is. So, bedside manner, establishing the relationship with the patient, earning their trust is the biggest thing.
Yeah.
And especially as a rheumatologist, for someone that you'll be taking care of lifelong, essentially, I think it's absolutely important.
So how do you think working in this career has really changed, for example, like your attitude, values, or any of your beliefs, or have you like developed any like other skills that you didn't have before, just because of like the way you have a conversation with your patients or in that environment?
I think I'm just more, you're always appreciative being in the medical field for what you can do for patients, but I think being a med student and observing and seeing patients here and there, and then being in residency and being in a hospital environment, and now finding this is my passion. It's something I absolutely love doing. So being able to do that every day, you're just so much more grateful that people are trusting you with their lives. So I'm just grateful waking up every day knowing that I get to go in, and it's fun. Work is fun for me. I'm not like, oh my God, I ain't going to work. I actually do enjoy it because I know I'm going to see these patients that, again, I have like a rapport with, and the staff is great, and you just create an environment that makes it fun to go to work. And you're constantly learning. You're learning from your colleagues. You're learning from different patients because not everyone is black and white. So you just have an immense amount of gratitude for being able to be in this position. And then also just like knowing that you're going to constantly be challenged with different, patients and demographic and situations. And the fact that rheumatology is a collaborative field, I think it also has humbled me a lot to know that I can call on colleagues and other types of physicians and be like, hey, this patient has issues with their kidneys, and you're seeing them. Like, it becomes a conversation with other practicing physicians. So it really humbles you because the field is changing and not everything's black and white. In fact, I think they call rheumatology like the house of doctors because we get called in when nobody knows what's going on. For that time and time again. Have you?
Yeah. I haven't heard it, but it makes a lot of sense because nobody knows what's wrong with you until the rheumatologist comes in.
You're like, oh, okay, well, we've checked everything, every lab, and we don't know what this means now.
Must be an autoimmune disease.
Yeah, exactly. I've seen so many memes like that. I'm like, I don't know if this is necessarily true, but it does humble you, and it's like all of the emotions. It's like, it's good. There's some challenging days, but you have to constantly be learning and being open to learn, and learning from not only your colleagues, but from your patients.
Yeah. So how does technology play a role in rheumatic conditions? Because as you mentioned, you are younger than most of your counterparts. So I'm sure you're a little bit more tech forward.
So, and now it's like, I think it's the scene everywhere, but everything's computer based, like the whole charts on the computer, which I think our generation really appreciates. I worked in one office as all paper chart, and I was like, oh my God, like, what do I do? Like, where is this? And I just realized how challenging it is. So, that being said, that's not anything new. I just think it's the norm now. But more so on the aspect of like technology, I think, MRIs, ultrasounds, CT scans, x-rays, whatever, they've all been used, but now more so, I think they're being utilized to get diagnoses earlier. And a lot of my colleagues are now using ultrasound, and I've taken ultrasound, courses and worked with ultrasound techs, but to be able to do that, and you can find erosions and synovitis, like swelling of the joint that you normally won't see with the naked eye much sooner. So you can get to these diagnoses a lot faster. So I think these therapies, these not therapies, but these technologies that have been around for so long, I think now are just being utilized more and earlier. So I think that's really great for all of our patients.
Oh man, I've had an MRI, not the best experience ever.
I've heard, I can't say that I have, but no one seems to be thrilled about those.
They're not. You just sit in this little tunnel and they like shake you around and put the IV, and I'm like, no. And it was like 2 hours. And the worst part is like the people there lost the results.
Oh no! Did you have to do it again?
No, I was like, I don't care. Oh well.
You're like, done. I'm done here.
Yeah, I can't, like, I know that I'm definitely like not going for an MRI ever again unless it's like I really have to. I'd rather just go for an X-ray. It seems more chill, but I know that the MRI really finds the erosions and damage in like specific things rather than the X-ray.
Yeah, and the X-ray, you have like radiation, which you don't with an MRI. But yeah, if you want to get to sometimes the diagnosis much faster, you can erosions and things like that. You definitely want to use the MRI.
And the age-old stories, at least with arthritis patients, regardless of if you're pediatric or adult, the age-old stories are that they went hunting around for a diagnosis for years and it wasn't coming. And, you know, even like it took me about half a year to a year to get diagnosed.
And that's something I've definitely heard a lot of. Because I feel that people kind of throw by the wayside when you're like a kid and you're like, oh, I'm hurting. It's like, oh, you, again, like they're just, you know, attributing it to being a kid, maybe like, oh, you're just rough on the playground or whatever. And, you know, they're just not really paying mind to it because you're not older or that doesn't make sense. But yeah, I've seen a lot of patients that have had, you know, chronic back pain since they're, you know, age 30, and that's not normal.
Yeah.
And then they'll come to me and like, you know, 10 years later, because they're just like, oh, I've dealt with the pain for so long. And, you know, then they're diagnosed with an autoimmune condition. So I definitely don't think that it should go unnoticed.
Yeah. And what are some of the goals that you kind of have for the future in terms of where you're going at for like medicine and rheumatology?
So I definitely want to keep practicing. I definitely love what I do. But again, I want to create a community like you guys have with your following to gather people and really pay awareness to autoimmune conditions in general and spread awareness, whether that is through you know, support groups or talks or you know, gatherings of some sort. But I think it needs to spread beyond the clinic and just, you know, our geography and you know, make it almost like a statewide, nationwide, all of that, and get people together to kind of bring more awareness to something that's kind of gone, you know, sometimes people just neglect. So I wanted to be able to do that, and I want to be able to do it on a bigger spectrum through podcasts like these and really just incorporate social media, which is really the way a lot of us get our information these days. So social media and you know, medical knowledge together.
I mean, that's how I found you. Like, I mean, I watched Family Karma, but I had no idea you were a rheumatologist until I was like on Instagram and I saw.
And it's so funny because not a lot of people know what a rheumatologist is. And so I'll always get like, oh, what do you do? And it's like, I'm a rheumatologist. And they're like, dermatologist? And I'm like, no, not really. I had someone think that I was a interior designer because it said rheumatologist. So like, and I was like, I've literally never heard that before. That's honestly very clever. But I was like, I've never heard that one before.
I'll name the podcast episode Rheumatology.
I know. He's like, so do you do interior designing? And I'm like, excuse me?
I'm a doctor.
So yeah, getting awareness out. Everyone knows what a cardiologist is and a dermatologist and a gastroenterologist. So this really, it needs to be you know, people need to know about it. People need to be aware about it. And I don't, you know, it doesn't matter what you do, but
you need Shonda Rhimes to put a rheumatologist on Grey's Anatomy, and then everybody will know what a rheumatologist is.
I know. These really need to like step it up somehow. But I'm glad that there is a rheumatologist on television in some sort now.
Yeah.
Spreading awareness and you know.
I mean, it was so funny to me because I was just like, I watched the show like as a joke with my mom. And this is the only reality TV show she'll watch. The only one. And she hates reality TV. And I was like texting Natasha. I was like, Natasha, like, you have to watch it. Like, it's funny. And for us, at least, it's relatable, right? Like,
right, of course.
Right.
Yeah. That's the, you know, goal is to be relatable, you know, when you're of like Indian descent, but then educating people about the culture and bringing more diversity into the mix.
Yeah. And then when we found out you were a rheumatologist, we were like, Natasha, this is it. We just have to get her on now.
Hey, we've hit the lottery. This is, yeah, no, honestly, I'm so excited about the opportunities that have come from this, specifically medicine related, because it is so, so important. And I just really, you know, you go into a bubble of like medical school and residency and then fellowship, and you just don't go beyond your four walls sometimes and realize like, wow, people actually don't, like, there is a shortage of rheumatologists. People really don't know what we do exactly or what we treat. So this is, I think this is the most exciting part for me, is finally being able to talk about it. And
yeah.
so,
like we were so excited. We were so excited because we were like, you know, we know what a rheumatologist is because we were forced to have to know what a rheumatologist
right?
is.
Yeah, you're like, we found out really early on.
But then, you know, it kind of makes it easier to know that there are people like you that are spreading awareness and like, you know, out there talking about it. And it helps that, you know, in my experience, I haven't met many rheumatologists that look like me, you know, so it kind of helps to see, and you're young, and it means that there are people out there that are going to continue doing it.
Yeah, exactly. And I hope to, like, that's another thing. I really hope to inspire, you know, young kids, whether, you know, you're interested in healthcare in general or specifically medicine or specifically rheumatology, is just to go out there and find your passion and find your niche. And really, my dad always said, like, once you find what you're passionate about, it'll never be work. Like, you'll just spend your days and your lives like making it something that you enjoy. And that's really what it's become for me, is something that I truly am passionate about and something that I enjoy. I even coined this term happy hour with my patients. So it'll be like, it was like a Friday term, and I'll be like, oh, because we'd have half days on Fridays, and I'll be like, oh, you want to, you know, come to happy hour? And they're like, oh yeah. So I coined it because it would be like they're coming in for their shots. So I coined it happy hour. So now some of them are like, yeah, I'm here for happy hour. So I know what they're here for.
I mean, I prefer the other type of shots.
Yeah, well, you know, you got to make it fun. And they leave feeling good. It's all the right things, you know. It's equivalent to a shot. The other shot.
No.
Maybe not for you.
I mean, I wouldn't know, but like I'm assuming, like, for example, like joint injections and stuff. Like no. It's like, especially when you're like not sedated and you're just like getting the injection like right there. I think a lot of children
better
like,
if you don't look. It really is not. So I think you spend more time freaking out about it, but then you're like, oh, you're done. And that's really all my patients are. They're like hyperventilating, and they're like, oh my God, no. Tell me when you're going in. And it's like, okay, well, step by step by step. And I'm like, okay, I'm in. And they're like,
and they don't feel it.
Yeah. And they don't, and you know, we're like, oh, the injection's done. And it really, you know, once you've done enough of them, which I'm still early on, but I've luckily been trained to do, you know, enough that I feel comfortable. Yeah, it becomes like a no-brainer, and you understand the anatomy and you just go for it.
Yay. Exciting.
That's the type of doctor.
Don't pick me.
That's the type of doctor Natasha needs.
Yeah, we can make it fun. You'll never know.
I mean, like, for me, when I had it the second time, because I had it when I was like, I think I was in grade 10 or something like that, but it was like 10 joints, and that's not normal. Like, you're not supposed to. You
got 10 joints injected?
Yeah, which is not legal.
That is not, yeah.
Yeah, so I had to, because like no medication worked for me for the past 3 years, and my joints were like damaged and eroded. So I had to get like 10 shots, and that was like the worst thing ever. But they put me under anesthesia. When I came out of it, it was awful. Like, everything was red. Like, it was so painful. Couldn't move. It felt like really like swollen and like solid. I don't know how to explain it.
Well, 10's a lot. I mean, I usually stick to like maybe 2.
Yeah, 2. So then
pick your top 2 is what I say, because everyone's like, inject me everywhere, and I'm like, that's not how this works.
Yeah.
That means we're doing something wrong.
Yeah. And then like last month I got 2 because my pinky started to act up, you know, I don't know why, but those were fine. Like, I wasn't under anesthesia, and the rheumatologist did so well. I felt like I was like so scared, and she did it. Like you said, like it was done in like 2 seconds, and I didn't feel anything. So I was good.
Yeah. That's how it should be.
Yep.
Okay, moving on. In addition to being a doctor, you're also a model and a reality TV star. How do you manage all of these time commitments?
So everything kind of staggered. And, the first thing that happened was, well, obviously I was in medical school, and then I was bored. Honestly, I say this, but I was bored in one of my rotations, and there was a pageant, and I was like, you know what, maybe I should like do something out of my comfort zone. Like, I'm bored, I have some time, whatever. And so my girlfriends signed me up for this pageant, and they were doing it as well. So it was like, whatever, like we have a story, worst comes to worst, we have like a really fun story. So I ended up pulling the trigger and going through with it. Little did I know, ended up winning. Then you go to the next level, and so you win that, and so long story short, that was like the first thing that opened the door into modeling. And then this is all while med school is still going on, so it becomes really tough.
Yeah.
But getting through school was my main priority. So luckily, I was able to work with a lot of people around my schedule, which I think is so important when you're trying to juggle everything and do everything.
Yeah.
Figure out what the biggest priority is, and then everything else works around that. And then this happened in the last year. And again, all of the filming and whatnot was scheduled, when I could be there. And I didn't have the luxury of working from home, or, going away for a few hours and then coming back and doing it. So it was a lot of time commitment, but again, my priority has always been my patients and medicine. So everything else worked around that. And it still to this day is the case. I still do modeling gigs and fashion shoots and runway stuff. And that is secondary to my patients. But over time, you get the flexibility in your schedule to be able to make everything work. And I think finally now, being done with all the training part of it, you can actually like begin to enjoy all the things that you put on hold. So I did put modeling on hold for a while, public speaking, all of that stuff on hold. And now it's finally being like, I'm excited to finally be able to like get back out there and do everything again.
Yeah, and that's so much to kind of handle in a way, like even though you kind of like put it in your schedule, like I know in some parts of the show, because I was watching it the other day, like you come back from like work and you're kind of like, okay, now it's time to film. I don't know if that was like, that's probably real, right? Like you actually
It is real. It is real.
Okay, cool. I didn't know if it was
You put on a fresh pair of scrubs in the car, and then
and then you
because
go.
you always, as a doctor, you always carry extra pair of scrubs or whatever. And I just choose scrubs or sweatpants because it's like the easiest, most comfortable thing. I'm usually, unless I'm going somewhere specific. But yeah, that's literally how that works.
You just sit in the car, change. All right, time to film. But along those lines, like, is it definitely, it probably gets stressful sometimes, do you think?
Yeah, definitely. There's no shortage of stress. It's just I've become better, and I think everyone over time will learn to time manage for themselves, like what works best for you. So I think that is really something I've learned over time. And my, how I handle stress is different from everyone else. My, stress therapy, I guess, is exercising. So I always make it a point to like take an hour out of my day to go to the gym, and that's just my time for myself. And then just make everything else work. But yeah, it's definitely stressful, but it's not anything that I wouldn't want to do. So I'm definitely overextending myself for a lot of things, but that's just because I truly am passionate about all of it. And I hate to say it, but I want to do it all. So sometimes you gotta knock a few hours off of the sleep to do it.
That's definitely a lot of people. Like, I feel like you always want to, a lot of people are like very high achievers. Like even myself, like even if I'm so limited with my joints, it's like, I still want to do this independently and like, I'm going to do it. And
as you should. Life is short. And I think everyone realized that during the time of COVID, and with in terms of everything, relationships and, life in general. So it's just a matter of time to just go out there and get it, and whatever that is to you, and to everyone that's different. But for me, it was being able to get back to doing those things that I absolutely enjoyed, while keeping while keeping my career as far as medicine in line as well.
Yeah, and like, would you say that you, like in terms of like keeping your mental health like going really well and stuff, like
Yes.
exercising was your thing, or did you have other things that kind of helped you during this time?
Yeah, so I'm glad you brought up mental health because that has been like a very, again, taboo topic when it comes to like us in the Indian culture and talking about, sometimes we're human. We don't have good days every day. And there's definitely low points in our lives and high points in our lives. And I would be lying if I said that I've never had a terrible day or I've never been sad or, gone through bouts of depression or anything like that. Those are real life situations. And, I've kind of dealt with it all, but especially, more so like everyone else in the last year or 2 years. But for me, yeah, exercising is definitely one. And then carving out time to like live life. Like, I think we get so busy trying to make a life that we forget to live the life. And so like, that's what I've been doing for so long now is like, make a life, like career, study. And you just become almost robotic that you forget to like live life and fully enjoy like all the little moments, even all the highs, all the lows. And having a great support system is 100% like what has gotten me through some of my toughest times. Having great friends, great family. I think that's so, so important to get through all of these hurdles. You don't have to do it alone. And I'm such an independent person. And, sometimes you feel bad. You're like, I don't want to drag you into my mess, or I don't want to like, I don't want you have your own problems. I don't want you to like have to deal with mine. But like, that's really what the people that truly care about you are there for. And they, require the same support eventually on their end. So I think it's a give and take, and that's so important. So yeah, exercising and then finding time to spend with friends and family has been my saving grace for the last few years. This like trek through medicine can be pretty daunting.
So have you, talking about mental health and about everything that you do, have you ever been criticized for wanting to pursue a career in medicine, modeling, and the entertainment industry?
I don't think I've been necessarily criticized, but I've definitely had some people say like, oh, why? Like, just question why you want to do certain things.
Mm-hmm.
My closest friends and family have always been supportive, but there's always going to be people on the outside looking in, not really knowing who you are as a person, questioning why you do certain things or why you are doing certain things. So it is part of, I think, the territory and the life, but it's something I truly wanted to accomplish. And so I kind of set it was like mind over matter to me. And I just hustled and just made it happen. And I think that's an important take home is that like, you have to do what's right for you and what makes you happy. And it might seem totally unrealistic to a lot of people or like too much for a lot of people, but it's your life. And, the first thing is you got to make yourself happy.
Yeah. Has it gotten worse since you've been on the show? Like
as far as social media and stuff, like have people? No, it's actually like what I've loved about this whole experience is that a lot of people have really reached out with opening up to me about their autoimmune diseases and people like yourselves, which I'm really thrilled about. So it's really opened up a conversation that I've been wanting to have for the longest time. And I think that having a little bit of a platform to do that now has been helpful. So I've been getting a lot of positive feedback, a lot of people inspired to take the next step in their path towards medicine or open up about the conversations that they couldn't have with their friends or family regarding their conditions or just in general, like who I am as a person and what I stand for. I think it's been all positive. Of course, there's going to be, there's always a little sprinkle of negative, but it's just what you choose to focus on. And I don't focus on the negative. So
that's so good. I feel like sometimes it's really hard and you kind of get like caught up with like everything.
Yeah, it's like that's just how it works, right? Like it's like we always like hone in on the one negative part of our day or the one bad thing that happened, but there's like 50 good things that happen that you kind of just forget about. So it's a process, but sometimes you do have those days, but for the most part, you just have to remind yourself, like, hey, there are people that, you know, really gravitate towards you and you are making a difference. And, you know, remind yourself, like, hey, you are a good person.
Yes.
I'm gonna call Health Canada and ask them to fly me to Miami every month, every 3 months.
I'm flying to Tampa. Fly to Tampa. Yes, come visit. Come
No.
visit. Well, you'll be taken care of.
That's what we were talking about, is like, it's so funny that across, like, not the world or whatever, across
Yeah.
Florida's on the south end. It is across the world. Like, it's funny who you end up connecting with.
I think that's the beautiful part about this whole experience and what social media is. It definitely can have its negatives, and I completely understand that. But these like relationships that you build and the people that you meet and having ideas about how to make a change and how to build a community, I think is so important. And I think that wouldn't have happened a few years back. So this has been the beauty about social media, and I'm really like, I'm just so excited. Like, I can't even tell you, because when you all reached out to me, I was like, oh my gosh, like, this is exactly how it needs to be. Like, these conversations need to continue to happen. And
Sometimes we get left on red.
Yeah.
Huh?
Sometimes we get left on red.
No, I was just so thrilled to know that you guys are spreading awareness, and that's just something I'm really passionate about, and having these conversations. And I'm trying to do it more and more and more, so that, you know, by the time you guys become rheumatologists, if that's in the plans.
That one, not me.
Okay.
That one.
Yeah. So by the time that happens, people can be like, know exactly who you are, what you do, what you can do, what you're capable of, all of that.
Yeah. And you might just have to come back for a part 2, just because we like to have more conversations.
Yeah, totally. I'm here to open up dialogue and answer questions as best as I can.
Yeah.
I'm just excited that you guys even decided to do a podcast regarding this stuff. So
yeah. It was definitely some sort of push Trish had to kind of give me. It's really hard to like I feel like it was like really hard to tell people, like, okay, I have arthritis, like I'm like young.
No, 100%. I think that's a lot of the messages I get also on a daily basis, is like, hey, thanks for, you know, doing what you do, or I love my rheumatologist because I've known her for 15 years and she helped figure out what was wrong with me. And, you know, people are just sharing their stories, and they'll usually say something along the lines of like, I've never told anyone this before. You know, I'm so glad that there is a rheumatologist on television now. People are finally understanding what you guys do as a community.
Yeah.
So I think it's for me personally, it's very exciting doing what I do, but then now being able to take it to the next level.
If you could give one piece of advice to someone who wants to pursue a lot of different kind of careers and jobs and opportunities, who is like a youth or young adult, what would you kind of say to them?
Go for it. It is very daunting. It can seem like a lot to yourself. Like, I want to do this, this, and this, and like, how am I going to do all of it? Just start. It'll never happen if you don't start, and start somewhere, anywhere. So do it is like the first thing. Go for it. No endeavor is too big. For me, I'm just like in this world where I'm like, you can just do it all. And also have a good support system around you, because with success is failure, and with failure, you have to be able to get back up and keep going. And I can tell you time and time again throughout this journey, there was times where I'm like, maybe I'm not cut out to do this. And luckily, with the right, friends and family to kind of pick you up and remind you like you are capable, and this is just a minor setback, keep going, that you can get it. So there is a light at the end of the tunnel, and it is a journey. No matter what you decide to do, it will be a journey, but it'll be well worth it, because it's what you want to do. And if you're passionate about it, you're going to make it happen.
I mean, Natasha and I wear a lot of different hats too.
I love it.
Okay. How old do you think we are?
Well, considering you said JIA,
yeah,
and I want to say like now, maybe because you were diagnosed a few years back, I want to say like late teens, early 20s.
Okay. I'll be 21 this year.
Okay.
And Natasha is 18.
I just
Okay,
turned.
so I'm right in that ballpark.
Yeah.
Okay,
Yeah.
I got it right. I was like, gosh, I don't like this game. Because then I always ask people, like, how old do you think I am? And I get
I
a
don't
lot
know.
of different responses.
You look like you're in your late 20s.
Yeah, late 20s.
And I'm
Okay.
only guessing late 20s because you went through med school and everything.
Yeah, everyone says that, like, oh, now that we know what you do, this is like process of elimination. I think we figured out like how old you are. That worked for me. I'll take
Okay.
it.
That
Okay.
was not the game.
So we move
But-
on to our game.
Yes. Okay. So today's game is called Say the Word the Quickest. Okay. So
I don't know what's going on either. So
Did you
we're on
make
the
this
same
game
boat.
up, or is this like a game?
No,
we
made
make them up.
We make up all of our games.
Okay, all right.
Are we ready? Do you kind of understand? Like you just have to like
Yeah.
go. Like I just say
And
something.
then you'll decide like who has the better answer.
Either who has a better answer or who said it first. What do we want?
Oh, and you're looking for a specific word.
I'm looking for like any word.
Anything that fits
with
the
letter.
category.
Yeah.
Category and
Yeah.
the letter.
Okay.
So do we want to do like the most creative answer or like the quickest? Probably the quickest because I don't think this is
Yeah,
gonna be
I was like,
quick.
well, you're gonna be the judge of creativity, so
Yeah, I'll think about it. Okay, cool. Are you ready?
okay.
Okay, I'll say like the sentence and then you just yell. Okay. Food beginning with the letter Q.
Quinoa.
Yeah, she beat me there, man. I was confused.
I was like,
I
I
was gonna
don't
say
eat quinoa.
what were you gonna say?
yeah.
Nothing. I wasn't gonna say anything.
Oh,
I
quesadillas. Okay.
had no answer.
No, but quinoa wins. Like, good job. Trish, you're so slow, man.
It
Hurry
doesn't
up.
look like I eat anything that begins with a Q.
Okay.
No.
All right, next. Drink that begins with the letter M.
Mountain Dew.
Bro, I'm
What's
so
this
mad at
thing,
this game.
Martina? Trish,
This is like no, honestly, this is like my dream game. So like I've been practicing to be on this game show for like my whole life.
Now you're
I
gonna get
really
on.
like if you have a plug at Family Feud, like I really just
They're
want
gonna have a family karma edition. Don't worry.
I really
Yeah.
want to be on there.
Well, pretty much like at Family Feud.
Yeah,
Hopefully.
please get me on Family Feud. Like
That's
I
how we
really-
do everything. We just at people. We
that's how
added Shonda Rhimes.
Yeah, that's how we got here.
Yeah, exactly.
Don't
Okay.
underestimate the power of a tag.
Yeah. Okay, Trish, please step up your game. Brand beginning with the letter K.
Wait, what?
Kit
Sorry.
Kat.
Brand?
A brand.
Does
Oh, you
Kit
can
Kat
have
count?
it. You can have it, Trish. It's fine.
Yeah, Kit Kat.
It
Good
counts?
job. Yeah.
I
You can have it.
really want to eat.
I'll let you catch up. You can have it.
Ouch. Okay.
I really want a Kit Kat.
That is not okay. Celebrity beginning with the letter J.
Justin Bieber.
That was good. I don't
That
know
was
why.
so easy. Good job. Oh
I
man.
paused. I was like, Jay.
JIA. I'm kidding. That's not a celebrity. Okay. Show beginning with the letter F.
Family Karma.
Come here. She got it first.
Actually, the letter was something else, but then I realized I might as well, like, integrate it into this. Okay, cool. So it's 3-2. Trish is losing with 2.
As
All
usual.
right. Animal beginning with the letter A.
Armadillo.
Yeah, I wasn't gonna think of that.
I just
That
thought of
was-
it because of Friends.
I was thinking apple. That's not an animal, though.
Not an animal.
That is not.
I know, but like, who thinks of like armadillo?
Somehow I did.
Okay.
That's because she's the smartest one out of all three of us.
All right. A name beginning with the letter W.
Wendy.
I was thinking like Winston. I don't know why. I don't know. That's not a name. I'm pretty sure. Unless someone's
Winston's a name.
Winston out there. I'm sorry, Winston.
Winston Churchill.
Yes, correct. Actually, I didn't think of that.
To
I did not.
apologize to Winston.
I apologize to the Churchill family.
Okay. A sport beginning with the letter C.
Cricket.
Oh, so brown, man.
Yeah.
That was really brown. I couldn't think of anything else.
I was like crochet. Crochet is not. What was it? Croquet.
Croquet. That's the one with that it's like golf.
Yeah,
but it's-
crochet is.
Yeah. Croquet is like the easy golf, I think.
Yeah.
I don't know.
It's the polo club.
All right.
I'll probably anger a lot of British people by saying that.
You know. Sorry.
Okay, we're gonna cut that out, I think. All right. Clothing beginning with the letter R.
Running shoes? Are those
Oh.
clothing? Does that count?
Yeah, I mean that works. I don't know what else works, but I guess you would.
Rags?
A
Like
romper.
Oh,
Oh,
yeah.
romper.
Romper. That's better.
That's so much better than a running shoe. Okay, Monica.
Quiet, Natasha.
Monica.
She's playing both skills. She's playing the creativity and the first, like the quickest.
Yeah, sorry, Trish.
Whatever she feels like.
Yeah.
No, that's how our games will go.
All right. Furniture with the letter C.
Couch.
Oh my god.
That was at the exact same time, too.
No, it was a lag, probably. I heard Monica first.
Yeah, I think I said it first.
Whatever. I said it at the same time.
There's no lag on my end.
No lag. Okay, last one. Netflix TV show with the letter N.
Narcos.
I don't.
That
watch-
is on Netflix.
I have no clue what that is, but
It is on
bingo.
Netflix. I can prove this.
I should probably. I don't watch a lot of TV
I don't either.
streaming anything.
My
Oh,
boyfriend
really?
likes this show.
Okay, I've heard about it.
There's two of them.
Can't say-
Narcos and Narcos Mexico.
Oh gosh, I thought it was in Mexico.
I don't know. Where's the original one?
No idea. All right, that's the end of the game. Monica wins, I think, by 1 point.
Yes.
There's no prize, unfortunately. The prize is that you got to be here. That's Sorry, there's nothing better.
No, really, I'll take it. It's a win for everyone.
Yes, we all win. Trish,
Yeah.
you finally won ish.
Quiet.
So that was a really fun game. I hope, Monica, you enjoyed it. I hope Trish enjoyed it too. And thank you for coming on. We really want to thank you for taking the time out of your day to being here, because you are a busy person and we definitely want to make your time valuable. So,
No, you guys did. This was honestly so much fun. I hope people really gravitate towards it. And if there are any more questions or topics you guys want to specifically talk about, be happy to come back.
Yeah.
Part 2, everyone. Vote in the comments. I'm kidding. Okay. Like, comment, subscribe, check out Monica's social media channels. We'll link them down below. Watch Family Karma, because why not? It's actually pretty entertaining. I tried to watch Grey's Anatomy while watching Family Karma, and I was leaning towards Family Karma. I just like the drama and I just want to keep watching it. All right. So hopefully everyone feels the same way, and we'll see everyone next week on Take a Pain Check.
Bye.
Can't